Hi everyone, thanks for tuning in today to learn about the Stay on Your Feet Remove Hazards grants. My name is Jo Collins and I'm an Injury Prevention Coordinator at Injury Matters. I'd like to acknowledge the Whadjuk Noongar people as the traditional custodians of the land in which I deliver this webinar from today and pay my respects to the elders past, present and emerging. So today's Stay on Your Feet Remove Hazards webinar, I'll be giving you a background into falls in WA. We'll have a look at the Stay on Your Feet program and grants. I'll have a talk about the background and messaging behind the Remove Hazards grants. We'll talk through the application progress for the Remove Hazards grants round, and I'll also talk a bit about COVID-19 and the impact that this will have on the grants. So a bit about Injury Matters. We are for safer people and places. Injury Matters aims to prevent and reduce the impact of injury within the Western Australian community. We do this through advocating and providing education for injury prevention, as well as providing support for those that are impacted by injury. So today's webinar is brought to you through our Stay on Your Feet program with the support of the Department of Health WA. Our Stay on Your Feet program provides information, training and support to older adult community members and professionals working with older adults around how to prevent falls in the community. So Stay on Your Feet has three key messages that we use throughout our campaigns and community and workforce engagement. And these three messages are move your body, improve your health and remove hazards. And this is where we get the overarching move, improve, remove slogan. This messaging focuses on modifiable risk factors to prevent falls, and the messages are designed for older adults who live in the community, their family and carers, and also for the people that work with older adults. So we're here today to talk about the Remove Hazards campaign and grants that we'll be providing funding for which expression are currently open. So a bit about falls in Western Australia. We know that as people age, their risk of experiencing a fall increases. 1 in 3 people over the age of 65 fall each year, and this number increases with age to 1 in 2 people over the age of 80 falling each year. And in WA, a person dies from a fall every 26 hours, is hospitalised due to a falls-related incident every 20 minutes, and attends an emergency department every 12 minutes as the result of a fall. Collectively, falls-related hospitalisations in WA in 2017 resulted in over 150,000 bed days at an estimated annual cost of over $220 million. And this is inclusive of healthcare costs, long-term care needs, loss in paid productivity, and also in the quality of life that's lost. And alongside the financial and systematic burden of falls, we also know that a fall has a huge impact on the individual and the people around them. So a fall can increase an individual's fear of falling, can affect their confidence, social activity, mobility and cognitive ability. This can then affect their activities of daily living, their quality of life, and it also places the person at a higher risk of having another fall. So injury really impacts many of us, and it has a carry-on effect from the individual level to community and population systems as well. It can affect the day-to-day life of family members and partners, create financial dependence on those that are around the person that has had a fall, and it can also decrease productivity of a person at work, additionally affecting colleagues and workplaces as well. So each year we deliver 2 Stay on Your Feet campaigns from March to May and September to November, for which we rotate through the themes of move, improve and remove. Our next campaign, as you may have guessed, will be based around remove hazards. For each campaign, we provide grants of up to $5,000 per grant plus GST for successful applicants, and up to a total of $15,000 plus GST for each round of grants. In terms of eligibility, those that can apply for a grant include incorporated community groups and not-for-profit organisations, qualified health professionals, community workers, fitness professionals that work with older adults, retirement and lifestyle villages, local governments and health service units. Unfortunately, hospitals and residential aged care facilities that don't, and applicants that don't have an ABN aren't eligible to apply. I suggest that if you aren't eligible but can see that there is a need for falls prevention activities in your community, then to get in touch with local services or your local government and encourage them to have a look at our grants. They just won't be able to apply for any hospital or residential aged care activities. Our Stay on Your Feet grants focus on those modifiable risk factors for falling under the Move Your Body, Improve Your Health and Remove messages. So I'll talk a little bit about what Remove Hazards is all about. Remove Hazards focuses on the risk factors related to hazards in the home, eyesight and footwear, and this forms a theme of Make Your Home Safer, which focuses on creating a safe home environment, Check Your Eyesight, which looks at eye health and healthy vision, and Wear Safe Footwear, which focuses on foot-related health as well as safe and supportive footwear. So when looking at the home environment, there are many environmental hazards in and around the home that can increase the risk of having a fall. And some of the leading areas in the home in which falls occur are hallways and entryways, outdoor areas, bathrooms, bedrooms, and kitchens. Some of the common hazards inside the home are poor lighting, clutter around the house, uneven or slippery floors, loose carpets and rugs, cords, and also pets as well. Some of the common hazards in the environment that's surrounding the home are hoses or garden tools that are left on the ground, uneven pavement, and also dark pathways at night time. And this can result in slips, trips and falls in and around the home. So if we look at eyesight in older people, research shows us that older adults with vision impairment are twice as likely to fall as older adults without any vision loss. Factors like poor clarity of vision, sensitivity to glare, and poor depth perception are all things that can increase someone's risk of having a fall. Behaviours like using multifocal glasses can also affect contrast sensitivity and depth perception, which again increases the risk of someone having a fall. And if we look at feet and podiatry in older people, we know that 20 to 45% of older adults experience foot-related problems that are risk factors for falls, and this can be foot pain or weakness, reduced range of motion, and toe deformity. Wearing unsafe footwear that's unsupportive and not fitted correctly can also be a huge influence to a person's posture and balance, and then again, risk of having a fall. So there's a bit of an overview of what we can do. In reducing falls-related environmental hazards, the home environment should be checked for hazards and these removed to minimise the risk of falls. Interventions regarding vision, such as regular eye checks, the use of correctly prescribed glasses, and the removal of tripping hazards in the home can reduce the risk of vision-related falls. And to reduce the risk of foot-related falls, older people can wear safe footwear to improve their stability and make sure that their shoes are appropriately fitted as well. And if concerns do present, then people should be referred to a health professional like their GP, optometrist and podiatrist to look at the need for any treatment and how they can reduce their risk of injury. The key messages and calls to action for the Remove Hazards grants are focused around this background information and these risk factors that I just described. So our key messages are our overarching and main messages that we want older people to know and to take notice of as being important in relation to falls. So these are: make your home safer by removing hazards in and around the house, look after your eyes and check your eyesight, take care of your feet, help you stay active and mobile, and falls are preventable. Our calls to action then are these take-home messages that we want older people to go away and actually implement. And these are to use the Stay on Your Feet home safety checklist to look for hazards in and around a home, to see an optometrist for eye checks every 2 years or if your vision changes, Check your feet and see a podiatrist if you notice any changes. Wear safe footwear that fits well. Create a falls action plan and tell a GP if you've had a fall. These key messages and calls to action were developed in consultation with health professionals, as well as our Stay on Your Feet peer volunteers, to make sure that this info that we're providing to the community is not only accurate, but communicated in a way that is relatable to older people. So something that you'll be asked when writing up your expression of interest or full application is how your proposed activities align with these key messages and calls to action. So please keep thinking back to this as you think of ideas of what you'd like to submit with your application. So I'll just take you through the process of applying for a grant and also what to expect following being awarded a grant if you are successful in receiving one. In the process of applying for a grant, this consists of both an expression of interest and full application stage, and both of these can be seen in the Remove Hazards application kit. So the application kit, if you haven't had a look at, it looks like this, and it can be downloaded from the Stay on Your Feet website. The link to our grants page is at the bottom of the slide here, or you can just use the search box on the website to search for grants and it'll come up with the relevant information. As you can see, our expressions of interest opened a couple of weeks ago, and we have a closing date of Friday, the 29th of May. The process for submitting an expression of interest isn't huge. We don't want to waste anyone's time, so we've made this as simple as we can while still gaining enough information to see if we'd like to shortlist you for a full application submission. The expressions of interest consist of 4 main but short questions, just for us to get a feel of what you want to do, why your project is needed, and how you will engage the older community while still keeping them safe during the COVID-19 pandemic. And I will speak a bit later on about COVID-19 and the impact that this has on the current grant round. So in the expressions of interest, we do also ask about what partnerships you currently have or will form to conduct your grant activities, as well as asking for an approximate figure for your budget and in-kind support that you would contribute. So in-kind support is any kind of non-cash resourcing that you'll provide on your end, things like the working hours that your employees will contribute, any equipment or software that you already own that you would use, or any event spaces that your organisation might have that you don't need to pay for. That would all be in-kind support. We really encourage you to use whatever in-kind support that you can to reduce your funding so that we can fund more falls prevention activities around WA. So what happens after you submitted an expression of interest? All expressions of interest will be reviewed internally by the injury prevention team at Injury Matters, and this will be completed using a scoring process. In the back of the application kit, you can see a scoring matrix that will be used for the full applications, and a very similar process will be used for the expressions of interest shortlisting. Successful expressions of interest will then be shortlisted and invited to complete a full application. And at this stage, we'll also let you know if you're unsuccessful too. Those that are successful will then have about 2.5 to 3 weeks to finalise and submit their full application. As you'll see in the application kit, the full applications do require a bit more detail, although you're able to use your responses from the expression of interest and build on these to form your responses. So the full application stage consists of 12 questions, and this is where we ask you to provide a more detailed summary of your activities. We ask you to spend some time on setting some SMART objectives. These are objectives that are specific, measurable, achievable, relevant and timely. You'll also find a template for setting SMART objectives in the application kit to assist you. So in the full application, you'll also be asked to describe how you promote your activities, how you evaluate your activities, potential sustainability of them past the grant period, and as well as any risk management plans that you'll have in place. Full applications will then close on Monday, the 6th of July, and similar to the expression of interest progress, they'll be scored by a panel, this time with the addition of some external panel members. And we will be using the scoring criteria that can be viewed at the end of the application kit. Successful and unsuccessful applicants will then be advised of the outcome of their application. Grant money will be distributed, and the delivery of grant activities will happen from September to November this year. If I'm able to, and if restrictions allow it, I'll also come out and visit the grant recipients and see some of the activities that are happening during this period. So what can we offer you? In addition to supplying you with funding to implement falls prevention activities, we do also very much see these grants as a professional development opportunity, particularly for applicants that might not have a lot of experience in applying for grants. As part of the Stay on Your Feet grants, we do also offer coaching throughout the entire process. And this could be anything from having an idea but not being sure how to put it into an expression of interest, discussing ideas for grant activities and aligning them with the key messages and calls to action, building up the rationale for your activities, planning or setting SMART objectives, developing an evaluation plan, forming partnerships, how to work your activities around COVID-19. And I really encourage you to get in touch even from the start to discuss your ideas that you have and how you'll put them into practice. So what are we looking for in applications? We want to see a clear need from your proposed project or activities. So defining a need could be identifying a gap in services or knowledge that needs filling in your community. It could be the presence of a high proportion of older people in your community or local government area. If you are a local government, does your project align with your public health plan? And it could also just be feedback that you've received from health professionals or even older people themselves for activities in your area. As I mentioned earlier, we'll also be looking for applications that align well with our Remove Hazards key messages and calls to action. So activities that are focused around creating safe home environments and enabling older people to identify and remove hazards in their home. Could be educating and enabling older people to get their eyes and feet or footwear checked. It could mean working in partnership with local community services or health professionals like optometrists, podiatrists, physios, OTs, or even services that sell footwear as well. We want to see you working collaboratively or in partnership. That will be looked on well in an application. Something that I haven't really touched on yet, which would be looked at favourably, is working with diverse populations. So like Aboriginal and Torres Strait Islander people, culturally diverse groups, people with a disability, or people living in regional and remote WA. I also want to refer you back to the application kit again, as this does have a clear outline of what we can and can't provide funding for. So for a bit of inspiration, I thought I'd share a couple of examples with you, some of our previous successful grant recipients and falls prevention activities that were implemented with our Stay on Your Feet funding. So example one is from a recent Stay on Your Feet Improve Your Health grants round, where the applicant was a metropolitan-based local government. The project supported the local government's current public health plan as well as the state public health plan. The applicant planned to deliver a series of falls prevention sessions to older adults that focused on the topics of nutrition, medicine management, and balance and strength exercises, all topics which align to the Improve Your Health key messages and calls to action. Partnerships were formed with local health professionals to facilitate these sessions, and they were also formed with other community services such as seniors groups, retirement villages, and the local Aboriginal Health and Wellness Centre. Older adults in the community were engaged to gain feedback on the structure of the sessions, around how it can be more inclusive of them, and also to identify suitable dates for the community. The applicant also planned to use their established partnerships and the results of their funded activities to seek further council funding and to support the delivery of the project again in the future. And this also highlighted the sustainability of the activities. So some key highlights of this application were a clear need of the project being identified, local partnerships were formed and used, the target group was engaged right from the start during the planning stages, and there was also potential for the sustainability of the project. So example 2 is from a Move Your Body grants round, where the applicant was a regional-based Aboriginal medical service. This applicant stood out as engaging Aboriginal people as a target group for falls, and it identified falls as one of the leading causes of hospital admissions for older Aboriginal people. They delivered a series of workshops to the local community and surrounding areas, and these included an educational component, exercise session, and a one-on-one assessment and shoe fitting from a podiatrist. This applicant provided a clear format of their sessions in their full application, as well as mitigation strategies for their activities. They used a low-cost venue that was culturally safe and accessible as well. So some standouts from this application were engaging a high-risk target group, the implementation of culturally safe activities, the inclusion of a clear risk management strategy, and once again, collaboration with local services. We acknowledge that times are tough at the moment due to the COVID-19 pandemic and its effect on services. And we do hope that these grants can boost some injury prevention activities and services in the current times. We are, however, committed to ensuring the safety of older community in WA as a high-risk group for COVID-19. So this means that at the present time, we will not be funding grant activities or events that involve close physical contact with older people. I know that times are changing quite rapidly at the moment, with restrictions being lifted from next week. However, we still recognise that older people are most vulnerable in these circumstances, and we will still not be funding in-person events or activities at this point in time. I think that something that we've learned over the last few months is just how accessible the community can be online. So I encourage you to think about how you can engage older people in this way. These are just some of the examples of the activities that we would consider funding at this stage, and these can also be found in the application kit online. So community sessions, like I described in the examples from previous rounds, that's something that could easily be implemented online. Do you have a public website that you could provide additions to increase access to falls-related information? Or do you maybe already have a falls-related website or online information that could be made more accessible? Vision is a key theme for this round of grants. So, you know, can some accessibility improvements be made for older adults that have low vision so that they can still access this information? Is there a lifestyle village or health or community centre that's frequently visited by older people that would benefit from environmental audit? Any localised resources that you think your community would benefit from and that could be developed and distributed? And this just doesn't have to be print resources. It could be a video or a series of videos that could be played in a health service, community centre, or even a library. If any of these examples jump out at you, then I really encourage you to just go with it and submit an application. Even though this is the scope of what we'll fund at this point in time, we are happy to be adaptable as changes are made in regards to the safety of engaging with older people. And if we do get further down the track and restrictions are lifted even more, then we're happy to work with you to adapt your activities as we see fit. I know that brings a bit of uncertainty back into the process again, but we'll always do our best to accommodate you with any changes that are made. Any changes that are made, we will communicate this through the Stay on Your Feet website. So I suggest that you keep an eye out on our grants page for any updates as we move forward. If anyone would like to get in touch, the best way in reaching out at the moment is via email. We're currently working from home and using personal mobile for work purposes. So if you have any questions, you've got any ideas, I encourage you to reach out and just have a chat with me about it. Flick me an email and I'll give you a call back and we can phone. So thanks everyone for tuning in today, and I look forward to seeing your applications.